Now, my remarks are not going to be long, but nevertheless, based on what you've heard before from your chairperson, Sister Daniel Wiggins, and what you will probably hear echoed by me as well as the Minister Hamilton, you would extract from what we are saying that what is required from this day onward is for you to render care and to become an advocate for care for persons who walk the halls of our various institutions as patients. Today, they may be your patients. Tomorrow, they may be your banker. They may be the teacher of your child, a police officer whose life is on the line to secure your own life. It may be the street cleaner or the garbage collector. But when they're here in this facility, or at Mary Charles, or at Pogson, they become your client and your customer, and ultimately the person who assists in paying your salary. Life is strange, and they are all reversals of roles that we go through. As Shakespeare himself said in his comedy, As You Like It, that all the world is a stage and all the men and women merely players, and they have their entrances and exits. And it's what we do while we are on the stage that matters. That being said, I wanted to focus a little bit of time speaking about why we are really here. And we are here because we are trying to advocate for care. And it is on that acronym I would like to spend a little bit of time in the hope that it will shed some light by the way in which you choose to guide your career as healthcare professionals. And it is from the acronym for the word CARE, C-A-R-E, which I will explain individually. For me, if I was in your place, I would look at that word care and its first letter C to be a composite of the care that you need to render, the compassion with which you render that care, and the confidentiality with which you regard patient information. That is essentially very important. Regrettably, just within the last week, we had to part company with a nursing attendant who did not see anything wrong with discussing a patient's business, to the point where, unfortunately, it was relayed to an entire school population because the information was shared with an 8-year-old child who lived in the house with that employee. Now, we don't want things like that happening, okay? And similarly, if you were the patient, you would not want anyone to be carrying out your personal business on the street. The second letter, A, and here I talk about attention. Attention to detail, attention to instructions, written as well as verbal instructions. Misinterpretation can cost lives. And of course, the word attitude, the second part of A. I note from the review of your overview provided by your instructors, as well as what matron would have submitted to the ministry, that a key component in your preparation, regardless of whether you were in the tract as a nursing attendant, a dietary aide, or a scrub technician, and that focus was on the word or the term work ethic. Part and parcel of your work ethic has to do with your attitude. Your attitude to your job, your attitude to those who are your supervisors, those who are in management, the patients for whom you have care, and your attitude to your colleagues, because none of you can do it alone. It takes a partnership effort. And that is something that for all of us is a work in progress, because we do not suddenly develop good attitudes overnight if we didn't have them, but they come with experience, sometimes painful experiences, and they come by us learning wisdom over time and deciding to make better decisions by remaining calm and ultimately allow your attitude and work ethic to show to the public without you having even to say a word. The third letter in the word is R, and that R for me means reliability and respect. By that, in terms of reliability, does it mean that rain or shine, you are going to show up and do your work? We know that all of us have personal lives outside of our jobs, and one morning you might get up and feel like pulling the pillow over your head because you don't feel well, you're tired, you had a bad experience the night before, you're up staying up with your child doing an SBA, or you just don't feel like going to work with certain people you figure you have to put up with every day. But patients depend on you, so you have to be reliable. You also have to be reliable in terms of carrying out instructions that you've been given. If there are problems with the instructions, you have a right to ask a question. We all know that we make a lot of jokes in terms of doctors having the worst handwriting. If you don't understand what is written, you go and you ask a question. You can't assume that they mean this or they mean that. That is part of what being responsible is all about. And the respect for yourself, respect for the uniform, respect for those in authority, respect for the job, and respect for the Ministry of Health. Once you're wearing the uniform, even if you're down the street buying bread and saltfish for a snack, people see you by the uniform and they make decisions about you. So please wear your uniform with pride, but use it as an extension of the respect that you have for your job, for the institution and the ministry that you're attached to, and also for yourself. And the last letter in the word care is E, and these should be obvious. And I'm speaking here in particular to empathy and excellence. Empathy, just like an extension of the first word, compassion, that I mentioned, means that you put yourself in the place of the patient. If the shoe was on the other foot, how would I want somebody else to treat me? Okay? Because the day will come, if you live long enough, that you will become a patient of this institution or some other institution if you have to go overseas. So put yourself in their place. We can't assume that patients are able to do for themselves more than what they do. Some of us sometimes forget, and we said, yes, man, you could get up. And you don't know, and I don't know. Because unfortunately, human endeavor is yet to come up with a meter that registers pain and suffering. So we can only take the patient's word for it. And also excellence. And that is obvious as well, because I am sure that even though there are 20 of you here who are graduating today, and one of your previous instructors would have listed who placed first, second, and third, it is not an indication that that is the position or the hierarchy that will continue in terms of how you do your job. Your job is to compete with no one else but yourself, so that at the end of each and every day, your resolve for the next day is to become a better version of you than you were the day before. Okay? And how do we get to cross that threshold of rendering care? It comes through several ways. It comes mainly by your continuing education, because I note that one of your requirements, as it is for all the other nurses through the system, is that you have to continue your career development hours. It doesn't make sense that we render care to patients if we do not remain current with what are the trends in the international healthcare industry. So your job in some of your spare time is to research and to read. Luckily for you, we live in an age of Google and Bing and so forth, that you could do a lot of internet searches and find information for free. The only thing it might cost you is the paper that you print it out on. Whereas the cost of textbooks might be expensive, the cost of CD-ROMs and so forth might be expensive. Quite a lot of them are available for free right on the internet, and all it takes is a mind that is inquisitive and an attitude and a thirst for learning. So that is something I wish to admonish that you do. I also wish that you would stay current with what is going on here locally within the Ministry of Health, especially paying attention to new challenges as they emerge, new provisions that are being made by the government. You would note from one of your earlier speakers that it was mentioned that 2 sections of your graduating class represent new areas for the Ministry of Health. And those 2 areas are the areas as they relate to the scrub technicians and also the dietary aides. And if I could quickly tell you the rationale behind the government and the cabinet in terms of why we went down this road for this new feature. When it comes to the scrub technicians, we wanted to make sure that we improved the turnaround time, especially in the operating theater. So it means then that we have extra hands on deck in terms of cleanup and so forth in between surgeries. It also means that we want to cut down on the rate of infection. Nurse Tuckett, I am sure that that is something that is a keen interest for you, because that is core of what your job description deals with. And of course, it's also a way for us to improve the overall efficiency in the operating theater. And of course, it also means that even though there might not be a surgery in progress, that your services will also be required elsewhere within the facility, perhaps generally as it relates to the reduction or elimination of infection. Now to the dietary aids. There are 2 of you graduating here today, and our need for the creation of this post is because we realize that the hospital patient population is increasing at a faster rate than the staff size serving the needs of the patients. Specifically when it comes to meal services, that has been a problem. And a large part of it has been due to the fact that St. Kitts and Nevis, like the rest of CARICOM, is facing a crisis as it relates to non-communicable diseases. Diseases such as cancer, hypertension and heart disease also are part and parcel of that. And by extension, our medical ward is full to bursting. The data I had yesterday from Sister Keynes demonstrated that we had a total of 84 patients in the hospital. That is a big number, because even though the facility has approximately 160 something beds, right, the fact is you don't ever want the hospital to be operating at prime capacity. You still want some room for redundancy because of issues that might pop up, emergencies that happen that we can't prepare for, and also breakdown in equipment, because what happens if a bed falls in? You have to take another bed from someplace else. But if you go on to continue operating using the same food service staff as the population for the hospital increases, it means that some persons get their meals late, some persons get their meals cold, and it also means that there's an increased likelihood that there could be mix-ups in terms of the meals that are distributed. And especially as it relates to the medical ward, where we have NCDs among persons who are diabetic and hypertensive, there are meal-specific guidelines in place, such as low salt for hypertensives, and of course low sugar for diabetics. And we don't want to mix up any of that. So your role is to assist the nutrition staff and the kitchen staff in making sure that the meal delivery is done on time, warm meals in an efficient manner. What I would want to say to you overall is that your instructors have invested a lot of valuable time training you, imparting their knowledge to you, bringing in guest lecturers and presenters as needed, with the goal that you will be the best that you can be and be equipped to hit the ground running right away. But again, as I said earlier, the rest is up to you. I wish to commend your instructors for the work that they have put in this process, Matron and her team, the in-service team with Sisters Keynes and Williams, by extension, Nurse Wiggins, Tuckett, and all of the others who have assisted in the process, the persons in housekeeping and kitchen who would have assisted in the whole process. Now, I also mentioned earlier that a number of you I recognize from your faces have been in the health system before, and I refer in particular to Michelle Pompey, who is right here, who placed 3rd in terms of the nursing attendance program. Michelle is someone who I grew up in the Ministry of Health knowing as a very good clerical and administrative staff member. And when she retired from the civil service a few years ago, it was a big loss to the Ministry of Health. But Michelle, I'm very glad that you came back and you're staying with us. The other person who I recognize is nursing assistant Jules, because I remember even from last year as a physiotherapy patient, she was one of the persons who would have assisted in my recovery at the physiotherapy department. So let them see you, okay? Okay? So I wish to congratulate them for their continued dedication and investment, and also the willingness to try new things, even within the Ministry of Health. So overall, I congratulate each and every one of you. I, like Matron and her team, will be looking on to see how you improve over time, with the goal that you will become at the top of your game, and that some of you might even contemplate higher learning and enhancement of your skill sets, because who knows, one of you might become matron of this facility over time. We don't know. So congratulations.